Good morning, everybody. I am Dr. Shweta Gupta Bhandari, once again the classical homeopath. And the topic of conversation today is aphorism number 241. As we all know, in Delhi, not only in Delhi, all across India, we are having third wave of COVID-19 going on. And in this, it is very important to discuss aphorism number 241 because, as we all know, in the first wave of COVID-19, homeopathic arsenic album and fluenzanum were employed as genus epidemicus. So today we will discuss what is genus epidemicus as per Organon of Medicine, Dr. Hahnemann, Organon of Medicine, 6th edition. Okay. As per the aphorism number 241, it clearly states the epidemicus of intermittent fever. We all know in COVID-19, the first symptom is like sneezing. After that, body ache starts with the fever. So epidemicus in intermittent fever, and it has a peculiar character. These are basically type of chronic manifestation. Chronic single episodic fever are these with peculiar common symptom and phase in all the individual attacked. Along with that, this aphorism states that in these cases where the same epidemic runs throughout the population, what we have to observe is we have to observe that peculiar common symptom which is common to all the infected individuals, and that makes the totality of symptom. On that note, we have to find the similibum, that is homeopathic specific of that condition, of that particular fever in that particular phase, in that particular wave itself. It's not if the genus epidemicus in COVID first wave is arsenic or influenza, then it will be same in the third wave also. So we have to just find out the specific homeopathic specific remedy for that particular phase, that peculiar common trend in all the population. And one thing that is very important is specified in this, that the patients who were having normal state of health, they were not having the chronic manifestation of any of the developed sora before the epidemic, has to be considered for genus epidemicus administration. It is not for the people who are having already chronic conditions running in the background, over that they got infected with the epidemic. Okay, and that we have to again work out in a different pattern. This is specifically for those people, those patients who have not suffered with any of the chronic developed soric manifestation before the onset of epidemic to them. Okay, so here is the genus epidemicus. We all know what is intermittent fever. Intermittent fever are those fever in which there is a pattern, there is an interval of high rate of fever, rising temperature followed by a normal body temperature. These are the intermittent fever. Okay, and the thing is ki these are the important thing is we all says ki in COVID-19 we are administering these are the acute manifestation, these are the acute phases. Sorry, but in aphorism 241 it is clearly mentioned these are the chronic manifestation. They are the acute attack of chronic manifestation. They cannot be classified as purely acute conditions. Okay, this is all about aphorism 241, and I want to definitely specify one more thing. As you all know, I do ICU, CCU in COVID-19. Let me tell you one thing. I don't think so कि you should go with a specific medicine in ICU, CCU cases or in COVID-19. I always consider cases of HRCTC above 10. In ICU, CCU, the cases which I deal normally have HRCTC score quite high. There are medicine like Viratum Viride is there, Carboveg is there. Viratum group is very much important in cases of emergencies. This is my personal observation. It can be different also, but we should try to go with a specific symptom. And in the morning itself, I got a query from some of my junior. They asked me to give me the insight about the complementary medicine. Let me tell you. Let me give to you the example of the same co-professional who asked me to help him in a case. When there is herring law implemented, I always told you earlier also, you have to find out the herring law. When the manifestation are coming from inside to outside, upward to downward, more important to less important organ, then it is an indication that yes, you have given the right prescription. You need to wait. Don't get panic now. That fellow gave the medicine and the symptom, the reversal of the symptom appeared. More important to less herring law implemented, the symptom appear from the more important organ to the less important organ. A patient having catarrh is being, after the administration of a simillimum, get coryza or sneezing. This is an obvious symptom. It has to be. The symptom has to go from inward to outward. So this is a manifestation. This is a Haring law implementation. You need to wait. Don't rush with the patient restlessness. Na? Till you feel ki, yeah, the intensity is going intolerable. In that case, you can reconsider. But don't touch the patient. Don't disturb the economy of the vital force if the already Haring law has been implemented. So do care, or don't rush in the prescriptions of COVID-19. Don't go with the high specific remedies. Don't keep on repeating the medicine. Single dose work wonderfully. When we are practicing classical homeopathy, when I'm telling you to go with the genus epidemicus, when I'm telling you, the moment you feel there is a relief, there is a change, Haring law is implemented, just need to wait and watch. Now Kent observation is appearing in this case, Haring law is implemented in the case, then what else you want? Do not disturb your case. That's why most of the homeopathic prescriptions go in vain, because you keep on repeating the medicine without any need. Okay, all the best. In case of query, you can ask me, and definitely I'm always there. But genus epidemicus is something to remember and to understand. Don't be prejudiced. Genus epidemicus does not mean you have to be prejudiced in every case. It is not like giving arsenic album to every patient. See, I already specified in 241 it is mentioned, patients who are suffering from chronic psoriatic manifestation or diseases are not qualified for genus epidemicus. And it is very rare these days to find a person who is not having psora or who is not suffering with the chronic manifestation of psora. Everybody knows that. Okay, next topic, I'll definitely look forward for aphorism number 242. Please go through the 242, 240 also. 241 is the main aphorism about genus epidemicus. That's why I specify this. Kindly go through it. In case of query, I'm always there. Be a proud homeopath. Work hard. Do read books. Do read your philosophies. Do have good roots, do have principles to work upon. Don't go on vague prescriptions. Don't go with the what patient is saying. Patient, you are asking a question, do you have this? The patient says, of course I have this. Like for example, in the morning the physician said me, I asked him whether you asked the patient what is the intensity of the symptom. He said the patient is saying, ma'am, he asked the patient, you are having catarrh? The patient said, yes, I am having catarrh. You should have asked the patient, how is your symptom of catarrh before administration of medicine and after administration of medicine. You have to compare it. You need not to ask the question. Definitely the patient is having the condition, he or she will say, yes, I am having this. You have to evaluate the intensity and the frequency of the symptom rather than the symptom. So be very specific in the follow-up of the case taking. Go with accurate case taking, do the proper follow-up, then make the observation, then panic. There is nothing to panic when the Haring law is implemented, when the Kent observations are appearing in your cases. Okay, all the best guys. Do work hard and don't comment upon my face or my personal things on Facebook messengers. Okay, I see everybody like compliment. I do appreciate your efforts, your compliment, but sometimes excess of everything is bad, The excess of this thing can lead to block block on the messenger on the Facebook. Please guys, don't send me nice, good, beautiful heart. And especially I mentioned many times, please be very vigilant in what you are writing on my messages, because I have to go through all the messages and sometimes I feel it's tiring also. I don't have time to reply to all the messages, and the moment I reply to a message, then again the conversation begins. Okay, I will consider everybody. I do visit messenger, I do reply everybody, and it is just that I don't want to waste my time or waste anybody's time. Please be very considerate and be on the point, be on the question itself. Don't wander here and there. Just ask a simple question, let me answer you. In case I need, there is a need to interact, to go in the specification or go in detail, I will make a video of it. Okay, all the best. Be a proud homeopath, be a classical homeopath, make Dr. Hanneman proud, and do study well and be true to yourself and serve humanity. All the best guys. Have a nice day. Bye.